Hi everyone, welcome back to Africa and Everywhere Conversations with Oge. This is season 2, and as you can see, we have a new setup. It's video now, so I'm very excited, and I hope you enjoyed this season. I'm your host, Oge Elumelu, and our very first guest is someone very special to me. She's known as a medical doctor. She is the CEO, chairman of Avon Medical and Avon HMO. And she's a co-trustee of the Oge Elumelu Foundation. But most importantly, or the way I know her, she's my mother. So I'm very excited to have her on here. She's also a running and fitness enthusiast, but we'll get into that in this episode. So thank you very much, Dr. Awele Elumelu, for being here.
Thank you so much for having me. This is really exciting.
Yeah, do you feel flattered to be my first guest?
I certainly do. Certainly do.
Yeah, and I think because last season, you saw Daddy on the podcast, so it was like,
when am I coming on? When is my turn?
But this time you're starting the podcast.
Yes.
So thanks for being here. Could you quickly? I've given a brief introduction, but could you introduce yourself to our audience?
Sure. So as you said, I'm Awele Elumelu, a medical doctor. I'm the chairperson of Avon HMO, which is a health insurance company or a health management organization. I'm also the chairperson of Avon Medical. I'm a co-founder of the Oge Elumelu Foundation. I'm a non-executive director on Hairs Holdings, which is a proprietary family company that sort of envelopes everything we talk about. And I'm the chairperson of Hairs Insurance Brokers.
Okay. Thank you very much. So the first question I wanted to ask is about how you came to be a doctor. So what was that moment that you decided, I think my dream career would be to become a medical doctor? And can you talk us through how you actually brought that into actualization?
Okay. Sure. But can I just say, I thought you were going to move from official to personal. So I have to say, because I can't leave this place without saying that I'm well, we've talked about how we saw Daddy, we saw my husband last week. So of course I'm last season. So of course I'm the wife of Oge Elumelu, but I'm also the mother of 7 fantastic children.
Oh, thank you. And I'm the first.
Of which this is the first? Yes, that's fantastic child.
Okay,
so we can get in now.
So your journey into medicine.
Medicine. Oh, I love medicine. But how did it really start? I mean, I think it was just being the only girl in a family of 5 children, so 4 brothers. I'm not the first, but then being the only girl, it was, and I guess now you find men do what women do, women do what men do, but then the woman was the carer, the housekeeper, the cook, the chef, the cleaner. So I had to look after my brothers, help my mom look after my brothers and the home. And then, like we know, in those days, in the 70s, once you're brilliant in school, in the sciences.
Yeah, my mom was brilliant. Like, she was actually brilliant in school.
We used to be, but hopefully we still are. So once you're good in school and in the sciences, the next thing would be medicine, which was fine for me because, I mean, I loved the sciences. I still love the sciences. And so I went into medicine. That's how, there were a few, temptations along the way. I wanted to be an engineer. I wanted to be an astronaut. I wanted to be a pilot. But because I love maths as well. I think maths is my favorite subject. But I love the sciences. And so I went into medicine. And that's how medicine came about. And no regrets.
Yeah. And how long? So back then it was 5 years, or was it longer than 5 years?
It was
Nigeria?
5 years. You know how Nigeria, then you could either enter through the JAM route, Joint Admissions and Matriculations Board, or you could do A-levels, the full 2 years of A-levels. So I entered through JAM. I didn't do the full A-levels of 2 years. And then when you enter through that, you do 6 years of medicine. So what people are doing 2 years A-levels, you do it in 1 year compounded. So I think they call it foundation in some places now.
Right.
So you do 1 year of that and then the 5 years of medicine. So I did 6 years in university.
Okay, fair enough. Thank you for explaining that. So the next question I want to ask is still related to medicine. That is the theme of this conversation, healthcare and medicine. But so you've told us that you studied medicine in university and then you initially started to practice a bit. I know you did your housemanship
in Lagos University.
Oh, was it Lagos?
No, I did my youth corps in Abuja, in the police clinic in Abuja.
Okay, but studied and then started practicing.
Yes.
And I want to ask a bit about what made you make that switch from practicing medicine to then eventually running a business in the healthcare sector. Like, what was the thinking behind that, and just how did it come to be?
Truth be told, I never actually saw myself in the beginning as, that wasn't in my immediate plan to set up a business. So I practiced, as you said, and then a newly married woman, you know, you want to have a family, and so at a point I had to sort of, after a few years of practicing, I had to, you know, take a step back and just try and start a family, then started a family. So for a long time I was actually not working as a medical doctor, which I actually missed. And then I decided I wanted to get back into medical practice. But then there's the children, you have to strike the balance.
And there
Am
were
I ready to? 5 at the time.
10.
Am I ready to start going and taking calls? Because I hadn't specialized at the point. So am I ready to go back into teaching hospital, take calls, the children are at home? I actually, funny enough, I started, truth be told. I did start, I don't know if I've ever told that part of the story. So I started in medicine department in Lagos University Teaching Hospital. But then I did. And then I just found it wasn't working. So I had to leave that again. And then the children. So I finally decided, you know, what's the best thing I can do? I want to practice medicine, but I still want to have my time to myself. And then you see the shortcomings in medicine, you think, what can I do? But to cut a long story short, that was how I went into it. I thought, we want to practice medicine. I want to do my own little bit. I want to see what I can do to improve healthcare, to contribute to the development of healthcare in Nigeria, in Africa, to, in a nutshell, just contribute my own quota in the development of healthcare. And that was how I got into it. I was lucky enough to have been able to do it, but that was how I got into setting up, you know, what we have now, which, you know, will if I were to go into it, it's, as I said in the beginning,
Yeah, please go into it.
It's the Avon medical practice, which is the health delivery angle, which basically is, we have a network of hospitals and clinics, and then there's a health insurance, which is Avon HMO, which provides health insurance, because we believe that we need to make healthcare more accessible to people. And so through health insurance, we're able to help people, you know, give people that access to healthcare. With the hospital, Avon medical practice, we have the hospital, we have clinics, we have on-site clinics, we have in different parts of Nigeria. With that, we want to be able to provide as much as we can, as close as we can, world-class, you know, healthcare service, affordable, because we know it's not easy for a lot of people. So we try to provide as close as possible to world-class services. I would say world-class services, but why I keep saying as close as possible is because we know affordability is a challenge. So we try and do as much as we can, try and give people as good health quality as we can, but making sure it's not overpriced, making sure they can still afford, you know, these healthcare services. Because really, along the way, you know, as I said, I worked initially, we saw some of these challenges. Access to healthcare. There are lots of people who can't afford to access healthcare. Yes, you know, I was in the teaching hospital in the beginning of my career as a medical doctor. You'd see people who either they wouldn't come to hospital because they couldn't afford to, or they'd come when it was really late and there was not much you could do. Sometimes they'd be in the hospital and you'd want to do more things for them, but they couldn't afford them. We know some of these things are teaching hospitals, so there are different issues. There's the issue of people being able to afford healthcare. There's the issue of even we being able to provide the healthcare, both from the public angle, being the government, and from the private. So you find people have to still pay. So many Nigerians pay out of pocket. If we go down into that, upwards of 60–70% of Nigerians still have to pay out of pocket for healthcare, and that's just not good enough. So, you know, I'm talking about so many things at the same time. We're talking about providing healthcare, but we're talking about the access. So when we have so many people paying out of pocket, you start to think, what can I do? And these are some of the things that give birth to health insurance. With health insurance, which a lot of Nigerians have not been aware of, awareness is increasing. But I mean, look at when we started, health insurance coverage was only 4 or 5%. But with you know, educating people, increasing awareness, making health insurance available. We've managed to bring it up slightly in Nigeria to about 10%. Still not what it should be,
Yeah,
but
so quite low.
you continue to try. We continue to try.
And could you, sorry, thank you for giving that in-depth explanation, but could you just explain to someone that might not understand how insurance works, especially in the health sector, what is health insurance? Like, because you're talking about how a lot of Nigerians pay out of pocket.
Yes.
So that implies that, oh, there's another method. So how does health insurance?
It's very important. We need to educate people. So basically what it is, it's like any form of insurance. But what happens is you have to pay a premium, a small amount every month, so that when you need healthcare, you don't have to pay out of pocket. You're paying to an insurance company, like any other insurance, as I said, such that at that time when you require the insurance, the healthcare cover, the insurance company can pay for you. A lot of people don't fully understand it. A lot of companies have taken this up, and so we find that most of the health insurance we have is from corporates. People's companies pay for them. But we're trying to build up the awareness in people. We're trying to get people to understand that you by yourself, you on your own, can make these little payments, monthly payments, such that you're not stranded when that big thing comes up. People realize how important it is when they find themselves in positions where they need major surgery, where we don't pray for accidents, but accidents happen. We don't pray for illnesses where we have to have surgeries, but they happen. And then they realize that that's, how many thousand, 2,000, 6,000 I've been paying every month has made it possible for me to be given this surgery that costs millions, not even, sometimes millions, yes.
Millions.
So that's basically what health insurance is. So we keep trying to educate people. We keep trying to make them understand that this is not a luxury.
Yeah.
It's not a luxury at all, it's a necessity. And it's key, it's very important that people, buy into this and get some health insurance.
Okay, thank you so much for explaining.
With Avon HMO.
Yeah, no, exactly, with Avon. No one else right now. And I thought you had Avon on, never mind. Yeah, but with Avon.
Yes.
And thank you for explaining that, especially going into what actually health insurance is.
Yes.
And thank you for even just sharing the story of why you birthed Avon. I particularly found it encouraging to hear that, because it's something I think about a lot, how women kind of have to make a decision about what they want to do, start raising a family, but what about your career, And I found it encouraging to even hear that, okay, even though you had to pause, I think that whole thing of there's a time and a place for everything, and you didn't allow there to be a full stop.
The end, that was not
career.
the end, exactly.
It was more just a seasonal thing. Okay, in this
yes.
season, I'm trying to focus on this,
Yes.
and the kids have gotten a bit older, so I
Yes.
can now try and look for a way to bring my career back.
Exactly.
And I think that's something people can learn, maybe like
Yes.
definitely young Africans too, just thinking forward, like, okay, there's seasons and times for things at time, and so we've seen it work with you, thankfully, and so maybe someone can take this away and just think, okay, maybe this is not the time for something in my own life, but I can still come back to it. Yeah, so
I think it's important when you know what you enjoy doing as well. Even if you don't, even if you don't fully realize what it is, everybody has something that no matter how big or how little they believe they enjoy. Some people know exactly what they want to do, but some people will just realize, I like this thing, I like practicing medicine. And so I knew, as you said, I wanted to go back to it, but at the time it wasn't right. So yes, I think it's good for people to realize that you have to stop something doesn't mean it's the end. You can always go back to it.
And I think you tried to tie it into your whole new business world, right?
Yes. So it was, then again, I think that's sort of what I mean by I was lucky to have been able to do this. So we have the whole family, as you know, the whole family business. So it was easy to say, or relatively easy to say, we try to invest in areas that, long term, that we believe in doing well and doing good. So even though we have the areas that make more money, I realized that this ties in with our long-term vision, ties in with our philosophy within our family and our group of transforming lives, and of investing in sectors that actually help, increase both economic good and, social good. So this was one good way of linking it to our family, long-term plans, long-term vision.
Yeah.
And, so that was it.
Thank you. So the next question I want to ask is, going back to Nigeria's healthcare system, and perhaps this can be extrapolated to a lot of African countries that do struggle with ailments, disease, just poor health amongst their populations. What do you seem to see, or what do you think tend to be the most pressing issues we have with our healthcare sector in this country? Both if you want to take it public and private, or just in one?
Yes. Yeah, whatever, usually it applies to both angles, both private and public. Right now, our biggest problem is, what we all know, this Japa syndrome.
Yeah.
It's
I'm going to ask you about it.
every, healthcare person, anybody who owns a healthcare business I meet, even in the public sector, it's the jackpot thing. I was just the other day this was a dentist, and she was telling me it's so bad. It has never happened to her like this.
Yeah.
She's lost in the last few months 4 or 5 people. So, we thought we had bigger problems before. We thought we had problems of, lack of training, adequate training for our staff, because we know some time ago, the Japa syndrome was brain drain. So we had our professors and our lecturers leaving. So we thought that was the problem we had. There was a problem with training, adequate training for the upcoming doctors and healthcare personnel. Now, we don't even have them.
Yeah.
So not only did the professors leave some time ago, but we were able to train, build up slowly again. Now we have even the personnel leaving. So that's a big problem. But we also have the problem of, as I think I must have mentioned a bit of it, the facilities. It's a problem, both on the public level and on the private level. So that's why you have more private hospitals coming up, because people are trying to meet that need.
Sure.
We know government can't do it all alone. And if I go back to our philosophy within our group, we believe in Afro-capitalism, where we say
what's the name of the group? Sorry.
Hairs Holdings. Our group Hairs Holdings. We are strong believers in the philosophy of Afro-capitalism, where we say that the private sector has a role to play. Government can't do it all alone. The private sector must help to invest in those areas that, will help to develop the economy, will help to improve the social welfare of the people. And so you find more private hospitals coming up. And these are the problems we have, as I said, the Japa syndrome, the facilities, but private hospitals are stepping in and trying to improve healthcare so that, there's better healthcare services for the citizens.
Yeah, so those are what you say are the most pressing issues we have, at least in Nigeria.
In
the
Nigeria.
healthcare system. Okay, I want to ask you more about this Jaffa thing, but I think maybe I'll bring it in near the end, because I want to change the tone of our conversation a bit. So you're a medical doctor and you're interested in, adequate healthcare and being healthy, well, fit, etc. And I've been able to witness, this your new, really taking this seriously the past 10 years, I would say, but you've adopted it into your life, and a lot of people might know you are a long distance runner.
Long distance runner, yes.
Like Mo Farah. Not quite.
Not up to Mo Farah's level, but
you enjoy long distance running.
I do.
You've run quite a few marathons.
I have.
And I definitely want to talk about that, just trying to understand what birthed your interest in fitness and in trying to ensure that you embody wellness, and then through that you decided to embark on running. Like how did you even start running? I know how you started running, but people might not know how you started running. So how did that start, your running journey, and why?
It's, as you said, it's whichever angle you come from, it's just a desire to be healthy, a desire to be fit. So some people come at it from the angle of, I just had a baby, so I want to lose weight. Some come at it from the angle of, I just want to look
aesthetic.
Yes.
Yeah.
So for me, really, it was the first one. It was, by this time I'd had the 7 children.
Yeah.
I wanted to lose some weight. And I had never run in my life before. Some people will say, oh, they were athletes in school. I never did anything in school. So I thought, let me try and lose some weight. And then I'd walk on the treadmill, and I had a trainer who told me I should just start gradually, start running gradually on the treadmill. So I'd run a few minutes, and then I'll walk. I'd run a few minutes, and then I just carried on like that and continued walking. And then I found eventually I was running longer stretches, longer stretches of time in any fitness, in any exercise session. And then I thought to myself, oh, who knows, maybe I can do a 5-kilometer run one day.
Yeah.
And then I trained, and I did my very first 5 kilometers. And I must find that medal. I kept that medal for so long. I don't know what I've done with it, but I will dig it up. I think I know where it is. I must, in fact, I'll frame that first one. So I did my first 5 kilometers. You would think I did a marathon, but that was it. And then it just continued from there. I thought, oh, perhaps I can do 10 kilometers. Maybe I can do a half marathon. And one day I was saying to a cousin of mine after my first half marathon that maybe I'll do a marathon. Who knows? And she was like, oh, no, she's not interested in marathons. And then for a split second, I thought, maybe not. But I kept thinking, why not? Maybe I can do this. Maybe I can do this. And then COVID happened.
Yeah. So just for a timeline, you started your interval running in like 2016.
Yes.
Yeah, and then COVID was 2020.
COVID was 2020.
Yeah.
So by COVID, I had done a few half marathons, and COVID happened, and we're all locked up. In fact, it's so funny that during COVID, there's this lady, she set up this fantastic thing which really helped me. I was in a group where you had to do a half marathon every month. And then you would log in, you would send your details, half marathon, and then you had a target you could choose to do 1,000 kilometers a year or 2,000. Of course, trust me, I always went for the upper limit. Yeah. I said the 2,000 kilometers.
Yeah, nobody is chasing you. But yes.
So that really helps, having to do a half marathon every month, and then she would give you the medal at the end of the year. So where was I? So yes, by COVID struck.
2020, yeah.
And I remember being locked up in the house, trying to do my half marathon, and I'm sure you remember, I'd run up and down on the corridors.
Run too.
And
I
yes,
never did long distance, but I did. You would
all run with me. Run back and forth in the house, trying to do half marathon? 21 kilometers. So I'd run back and forth and back and forth. Anyway, so I did that, and then COVID came, and I found us, we were locked up, and then the children had to go back to school. I think it was your younger ones.
Yeah.
Had to go back to school, and so I went back with them. Basically, summary is I was locked up, and I thought, what can I do? I think I was searching, I Googled, and I saw a virtual marathon. This was a New York virtual marathon. I thought, wow.
Do we have it? Yeah, we have it here.
Yes. This is the medal from the New York virtual marathon. Fantastic. Yes, my very first marathon. Yeah. So right. I trained, and how it works. I mean, some people will think, how does the virtual marathon work? They use a platform. For them, they use Strava. And so everybody had to sign up with that, and then you do your marathon. I ran just by myself. I timed it, and I was so excited. There's another story behind that one. I have to tell the story.
Yeah, another interview.
I did the marathon. I had two different, what do they call them?
Oh yes, I remember. It was logged on two different
devices. The Strava, and I used NRC.
Nike? Yeah.
So I think what happened was, for my Strava, I don't know, something must have happened with the network. And it didn't capture the full 42 kilometers, but NRC captured it.
Okay.
I almost died. I had to write them. I guess this is something to learn from this is don't give up.
Resilience.
Don't ever give up. So the resilience of training, but the resilience of not giving up. I took my email and I sent the organizers of the New York Virtual Marathon, NYRR, New York Road Racers. I sent them a marathon appealing to them, saying, please, this is what happened. I sent a photograph of Strava. I sent a photograph of the NRC capturing the 42.2 kilometers. I said, I don't know what happened. Something happened. This is my NRC. You just have to believe me. I turned 50. I've never run in my life. I said, I want to run a marathon as I turn 50. I did this marathon. Please, I need my medal. I don't think I've ever told this story before. I need my medal. Please send me the medal. I don't know what I'll do if I don't have this. I don't know if I'll ever run another marathon, but I have to have my medal. I ran it at 50, someone that has never run before. And within a few weeks, or was it months, my medal appeared in the mail. I was so happy. So don't give up. If you believe if you really want something, just do all you can. I wrote that letter. I got my first medal. And I had said I would never run another marathon.
Yeah.
But
in
they
your
say once
true
that
style,
marathon thing bites you, marathon bug bites you, you continue.
crazy.
So should I tell you how I ran my second marathon?
Sure.
Or do you have more questions for me?
I have more questions.
Okay, go on.
I have more questions, but thank you for sharing that. It's so impressive because I have tried to train for running. Maximum, so I've done a 5K, I've done a 10K.
10, exactly, you have.
I wanted to train for a half marathon, and then my body was just kind of injured.
Yeah.
But I know how much discipline goes into this. Like, you have to be so disciplined.
True.
Showing up every day,
True.
watching what you eat,
True.
making sure you're strength training so you're able to run. So
True.
yeah, I just want to say it's so impressive, and I'm really glad I have someone like you to look up to. But just to quickly show, my mom has done, is it 7
marathons? 7 marathons
7
in total.
world majors.
No, world majors 5.
5 world
But
majors.
marathons 7.
Yes. So we have some here. This
That's
was
the
New York
virtual
virtual. This
My
was,
very first physical marathon was Manchester.
yeah, Manchester.
So I thought I should, after doing a virtual, like 2 years later, I thought, why not do a physical one? And so that was Manchester. This is the Manchester Marathon. No, this is London. This is Manchester. So that's the Manchester one. And then I thought, there's something called the majors. Why not do the majors? Abbott World Major Marathons. And then that was how I started.
Okay. Thank you for telling us about the inception of your marathons and the running. And I just wanted to ask, since you've done so many now, is there a goal behind this? Is there something you're trying to achieve through completing all these runs, or is it just for self-fulfillment? Yeah.
Yes, it's both for self, because it helps me keep fit. But then not just for self, I start from even my family, from within. You just want to be able to, I would say, inspire others, to help others, because people, sometimes you think something is outside of your reach, you think something is, you can't do this. But then you see someone who does something, and you think some ordinary person, not a Mo Farah, as you said, who does something, who doesn't spend their whole life training, but they're able to just devote a little time of their life, a little bit of time to, I guess, to this. And so that's one reason why I continue, because sometimes it is tiring. But then now I think there are actually some days where I say, if I just sit down and eat and sleep and do nothing, then some people who have been encouraged by what I've done may think, oh, so this is where it all ends. So you just sort of, I know it's pressure, but I mean, everywhere in life there's pressure. If you don't have any pressure, you really, what do you wake up for? So it's for me, for my own health. I feel much better, I feel well, I feel strong, but also to inspire others. Yeah. And a lot of people tell me, it's enough, you're 55 now, haven't you done enough? And I say to them, we think that, but when I go on these marathons, I see people much older than I am. They're 60-something year olds, 70-something year olds, 80-something year olds. You see a lot of, there was an 80-something year old woman in this Tokyo marathon I just went to, who was doing her 100, or was it 200 marathon. So, you just see, you see a lot of people, you're inspired by them, and you in turn want to inspire others. So that's why.
Yeah, no, you definitely helped to inspire, because I remember going back to Tokyo when we were preparing for it. It was like your 6th marathon, and you started the whole challenge for people to try and do 6,000 steps a day. And you had a lot of people that tuned in for that, like every day for 6 days, trying to do 6K. So I see what you're saying about trying to inspire, and I think you're definitely helping to encourage people to live more fit lives. So, okay. And then on that note of inspiring, just very briefly, I know that you are part of, as you said, one of the co-founders of the Oge Elumelu Foundation. We've had the founder on previously, but if you can just briefly share what the foundation means to you. Yeah.
So the Oge Elumelu Foundation is I'm so happy with what we're doing at the foundation, because really it's to be able to I'm trying to inspire and empower. I'm saying empower. But really, it's to empower young ones. Not everybody has the same opportunities. Not everybody has the same capabilities. So, basically to summarize, what would be do at the foundation is just to empower people who believe that they have something they can contribute. Because we know that, again, I go back to government can't do it all. So we believe that the entrepreneurs have a lot to offer. We believe that young Africans have a lot to offer. And that's what we do at the foundation, at Oge Elumelu Foundation, to train them, to mentor them, to fund. We fund quite a bit. Over the last, 10 years, we've committed over $100 million. And we've also had partners who have worked with us, committing their own funds as well. And because of this, we've been able to fund about 24,000 young African entrepreneurs and train so many more, through technology. Technology is amazing. What we've been able to do through technology, the hub where we train people, where we bring together, entrepreneurs and sponsors. So that's basically what we do, trying to build up that entrepreneurship ecosystem, trying to develop that power we see in our African youth and to give them that opportunity to develop themselves and develop their immediate communities and Africa.
Okay. Thank you for keeping that succinct, but very inspiring. I always like hearing about the work the foundation is doing. So thank you for that. I really enjoyed this conversation, but we have to start wrapping up.
Is it over already?
No. I have two more questions for you. So as I said, I wanted to come back to that Japa thing and kind of dig in deeper on it, because there is such a thing that is prevalent in Nigeria and in the sector that you're actually in, the health one. So if you were in front of an audience of our youngest Nigerians, or just young Nigerians that are straight out of med school and they're looking to go abroad, they actually want to go and train and work abroad, what would you say to them? What reasons would you give as to why they shouldn't, Japa? Like, why should they stay?
That's a difficult one. It's a difficult one because we know the challenges that there are. But we also know the opportunities that there are. So, and we know that if we all went away, who would be here? We know that there are opportunities here. We know that there's potential for Nigeria. Again, if we all went away, who would be here? I think it's important that people realize that we have to be here to help to develop Nigeria. We have to be here to help correct things, make things work the way that they should. It's not easy, but you get there. I mean, when I started this, I didn't think it was easy by any means. I didn't think it was going to be easy. But we've come a long way now. Just the other day, we opened up another hospital in Surulere, and we're doing our best. We see thousands. We've seen like about 200,000 people in that little, because that's where we're based in Surulere, in a little hospital. And as I said, there's several private hospitals doing what they can. Healthcare is key. Again, if we all go, you can't go with your whole family.
No.
You'll go, you'll still have your father, you'll have your mother, you have your brothers, your sisters, your cousins. And then what do? Some people say they have the money, they'll fly their people outside. Sometimes you have emergencies happen. We cannot all believe that when anything happens, we can get ourselves outside the country, we can get our loved ones outside the country. So we have to try to make sure we have a system that works. We have to make sure we have a healthcare system that can treat our people. Because you don't want you or your loved one to be that emergency case that because we have all taken off and left the country, something that could have been solved, they end up dying needlessly. So I think it's important for people to think and know that we need to develop our country. Nobody but us really will develop our country, so we need to stay back and help to develop our country.
Yeah.
Some people will go, but some people will also. I think the one good thing I see about people going is that link. So we that are here have to ensure that we maintain that link with people who are outside. We continue to tap into that expertise that is being developed by our people who have gone. So people who are here shouldn't give up. It's not completely completely hopeless because we have people who are out there and we have to keep believing that we can work with them to develop what we have here, which is what a lot of us are trying to do now.
Yeah.
So we can't just have that mindset and believe that if we haven't gone, we can't do anything. We can be here and we can work with those who have gone. And we find people are still trying to come back. A lot of people who are there are trying to come back to help, to build up the healthcare system here. So I don't think it's hopeless. I think there's a lot we can still do here, both ourselves and with those who have gone.
Thank you so much for answering that. I've just thought of a question actually as you were talking, because we just spoke about TEF and obviously entrepreneurship and trying to empower entrepreneurs, and then you spoke about how there's even people that try and come back to contribute to Nigeria's healthcare system. Do you think there's any space, or what do you think about entrepreneurs that are trying to provide or create their own business in the healthcare system? Do you have any thoughts on that, or do you think that's another way like Nigerians can contribute to our issues, or is it more just stay in the hospitals that already exist, the clinics that are already there?
No, not at all. We don't have almost enough. We need more. So sometimes people look at places like Lagos and think we have enough healthcare, we don't have enough doctors, we don't have enough hospitals. But Nigeria is beyond Lagos. So we need a lot more people to come in to develop the healthcare system. We need a lot more of the private sector. We know it's extremely capital intensive. We know the rewards are not immediate. So there's both the financial monetary rewards and the non-monetary rewards, in healthcare system. So we need more people, especially again the private sector. We know that the government has a role to play. So the government has to keep doing what it's doing, but we need people in the private sector to come in, to join forces with us, to build the healthcare system. We need people, the healthcare system. We need people to see, a lot of people talk about, the CSR and things like that. We need more organizations to, look inwards, dig deep, and see that this is one way that they can support the healthcare system. Because we have the doctors who want to do the clinical aspect of improving healthcare, but they need funding, they need support. So I think one easy way is for our organizations to focus on the healthcare sector as an area where they can contribute. And we're all winners at the end of it. If we develop our healthcare system, we will all benefit from it. So I think we need more people to come on board, and we need more organizations to support as well.
Thanks for adding that. That's a really good point I hadn't thought about. And I think we don't know who's listening to this, but it can be good to think about that, there's other ways I can contribute to developing Nigeria's healthcare system. So thank you very much. And then we're getting to our last question. I hope you've enjoyed.
I have enjoyed this. It's been a lovely discussion. As I said, I've said things that I didn't even realize I hadn't told anyone before.
Okay, nice. So my last question is going back to, I think you're a very inspiring person. I've said that how many times? Not just because you're my mom, but you studied medicine and started practicing, and you found a way to weave it into your life, being a mother, being a wife, and then also running your own business. So what advice would you give? I want to give this specifically to perhaps young Africans and women at that are trying to juggle all the things, and it seems like it's just impossible. They're trying to juggle pursuing their career, maybe pursuing a family life, maybe transitioning from one type of career to another. So what would you advise that women can do? How can they achieve it all, seemingly?
It's not easy. It is a juggling game. It's a balancing game. But then I think, as we had even mentioned a bit earlier in the discussion, it's knowing that you can do it all, at least most of it, but knowing that there's probably a time for everything. As I said, in my own experience, I did certain things at certain times. I practiced medicine at a time. At the time, I had to take a break. But then just knowing that taking a break is not the end. Knowing you can always come back to it. But know when you try what you can, but then if you find you need to take that break. But don't lose focus of your dream. Don't lose focus of, your vision. Just keep believing and working towards it. And, you will find a way to come back into it. But don't feel bad if you have to take that break, is what I would say. Come back into it and use, your support system, really. I have it was easy. I keep saying it was easy. Relatively easy for me because I had a husband who is extremely supportive, 150% supportive. So even while I was at home doing nothing, nothing as in from the professional angle, he never let me give up. He never let me say, oh, I can never go back into medicine. He always told me, don't worry, you will go back. Don't worry, you will go back. And when it was time to go back, he really supported me. And it's, I mean, largely because of him, I'm where I am. I have what I have. And even the business angle, because I mean, he is finance.
Yeah.
I'm a doctor. But he made sure he supported me with what I needed to be able to go into this business angle. And so even though we're talking to the young women, we need to address the young men as well.
That's true.
Please support your wives. Please support the young women because again, we all benefit when you support your wife or the woman, and you support the woman, you're helping her to support the children. You support the woman, you're supporting the children. You support the woman, you're supporting the family. You support the woman, you're supporting the community. So, just let's encourage the woman, but I want to encourage the men as well to support the women, please.
Thank you so much. We ended on a very good note, high note. So thank you for being my first guest of the season.
Fantastic.
I really appreciate it. And
Thank you for making me your first guest. It's been fantastic.
Thank you so much.
And well done. I've thoroughly enjoyed myself.
So thank you so much for today. And that's it. That was our first episode of season 2. This is your host, Oge Elumelu, and thank you for tuning into African Everywhere Conversations with Oge. Please make sure to like, subscribe, share, listen to this interview, and you can also listen on Apple Podcasts and Spotify. Thank you so much, and bye-bye. See you next time.